So this was an audit that I did into compliance with documentation surrounding patient-controlled analgesia pumps and epidural analgesia pumps. So they're the two most common methods of pain control in the postoperative patients, and with those two analgesia delivery systems, there's an increased risk of complications. So with PCA pumps, any patient with a continuous background of the opioid is at a greater risk of developing a respiratory depression, and so they require intensive observations. And with the epidural analgesia, when we're inserting the line and removing the line, there's an increased risk of complications, the main one being an epidural hematoma formation. So that's we're worried about causing paralysis or long-term nerve damage for patients. So we ask that when the line is removed, they're subject to more intensive observations again, really. So the audit itself, so we looked at, it was a retrospective audit to start with. So I pulled all the charts from a month and looked at the compliance of observations with hourly. So we asked that for patient-controlled analgesia, they have hourly respiratory observations, again to monitor for respiratory depression. And for the epidural analgesia, we ask that they have a sensory and motor block check for 48 hours after the line's been removed, just to identify any loss of function in case there was a hematoma forming. Unfortunately, the baseline results were a bit disconcerting, so our compliance wasn't great. So with PC observations, compliance was sitting about 20%, and for epidural observations, it was 0%. So moving on from that, I then did a series of educational interventions, so very intensive ward-based teaching, working with the nurses, finding out gaps in knowledge. We changed our in-house epidural study day. We never really had any formal PCA training, so we just tightened everything up around that. And then we did lots of work with the sisters and the matrons as well, just to really boost the need for these observations. In the re-audit, so we looked at it again after a period of 6 months, and thankfully the results have improved quite a bit actually, yeah. So we saw an 80% increase in observations for epidural analgesia, which is fantastic. And our PCA compliance has gone up to about 65–70% as well. So we're not quite at the 100% mark, which is what we would like, but it has made a massive difference. It's just kind of trying to instill that change in practice and change in the way of working, really. So it's been a very challenging 6 months to a year, yeah.